Hello, welcome back to Small Hearts, Loud Voices. My name is Adrian Adair, founder of Heartbeat Forward, and this is the podcast dedicated to making congenital heart disease impossible to ignore. So we talked about the children, we have sat with the parents, we have held the weight of the waiting room together. Today we turn to someone else. Today we talk about the people who are already in the room when the family arrives. The people who were there before the diagnosis and will be there long after the surgery is over. The people who hold the hands that are too small to hold themselves. The people who learn the names of every child on the unit, not because it's required of them, but because they could never imagine it any other way. Today we talk about the nurses. And every single person who shows up every single day in pediatric cardiac unit and gives everything that they have to the children and families who need it the most. This one is long overdue. Let us get into it. Here is something most people don't know about pediatric cardiac nursing. It's one of the most specialized, most demanding, most emotionally complex fields in all of nursing. Pediatric cardiac nurses care for some of the most critically ill children in any hospital. Children whose hearts are functioning at the edge of what is medically possible. Children who are days old. Children who are in the middle of 3-stage surgical journey that will span years of their lives. Children who are fighting with everything they have and sometimes lose. A pediatric cardiac intensive care nurse can care for a child through a successful surgery, celebrate a discharge, and then sit with a grieving family in the same week. Sometimes in the same day. They carry all of it. The American Association of Critical Care Nurses recognizes pediatric cardiac nursing as one of the highest specialties in critical care. These nurses complete years of specialized training beyond their base nursing education. Many hold advanced certifications in cardiac care. They understand echocardiograms and hemodynamic monitoring and complex medication protocols that most medical professionals outside of cardiology will never encounter in their careers. And they do all of that while also doing something that no certification can teach. They remember that the child is in the bed is not a diagnosis. They remember the favorite stuffed animal and the cartoon they like and the way they take their medication best. They remember the parents' names. They remember that the family has already been through. They show up at the start of every shift carrying all of that knowledge like it is the most natural thing in the world. Because for them it is. There are tens of thousands of pediatric cardiac nurses working in hospitals across this country right now. They are underpaid. They are under-recognized, and they are absolutely irreplaceable. This episode is for them. Her name is Rosa. She has been a pediatric cardiac nurse for 11 years. She did not plan to end up in a cardiac unit. She started her nursing career in general pediatrics, warm and competent, and certain that she had found her place. And then one afternoon, she was pulled to cover a shift in the cardiac intensive care unit, and something shifted inside her that she'd never been able to fully explain. She says it felt like finding a room in a house she had always lived in, but never opened the door to. She has been in that room ever since. In 11 years, Rosa has cared for hundreds of children with congenital heart disease. She has held babies through post-surgical pain in the middle of the night when their parents went home to sleep for the first time in 4 days, and she told them to go rest. I will not leave them. She has sat on the floor for a family consultation room with a mother who could not stand up after receiving news that changed everything, and just stayed there on the floor beside her because there was nowhere else to be. She has celebrated more discharges than she can count. She has decorated unit hallways with handmade signs for children going home after months of hospitalization. She has kept photographs of formal patients on her phone, not because she's required to, but because she needs to see them growing up, because their survival is part of her story too. She has also lost children, more than she can talk about without her voice changing. And she comes back every shift, every time. She comes back because the children who are still there need her. Because the parents who are still waiting need someone who knows their child's name and say it with love and means it. When you ask Rosa why she does this work, she is quiet for a moment, and then she says this: I do it because when a family walks into this unit, they are the most afraid they have ever been in their entire lives. And if I can be one thing in the moment that feels steady, that feels safe, and feels like someone actually sees them and their child as people and not just a case number, then I've done something that matters. I do it because it matters. That is the only reason I've ever needed. 11 years, hundreds of children, one room she never wants to leave. That is Rosa. And there are thousands of people exactly like her in cardiac units all over this country right now, doing the same quiet, extraordinary work, carrying the same weight, showing up with the same love. They deserve to be seen, and today we see them. This encouragement goes in two directions today. First, to the nurses, to Rosa and every person like her, to every cardiac nurse, respiratory therapist, child life specialist, unit secretary, hospital chaplain, and overnight technician who has ever given a piece of themselves to a child with congenital heart disease. You are seen. Not just by the families who thank you at discharge, not just by the parents who send you Christmas cards years later with photographs of children who are thriving because of what you did in the room most people will never see. But here, on this podcast, in this moment, what you do is not just a job, it is a calling. And the way you answer it, with your whole self, with your memory, and your steadiness, and your willingness to sit on the floor when sitting on the floor is what someone needs, is one of the most profound acts of service I've ever witnessed. You carry these children and these families in ways that never make the headline, in ways that do not come with the awards or recognition or any kind of visibility that this work deserves. You carry them anyway. You have always carried them anyway. Thank you does not feel like enough, but it is what I have, so thank you from every family who has ever felt less alone because you walked into the room. Thank you. And to the CHD families, to the parents who have been cared for by people like Rosa. If there is a nurse, a technician, a child life specialist, anyone who showed up for your child and your family in a moment when you needed it most, tell them. Write them a letter. Send a message to the unit. Let them know that what you did mattered. That you remembered. That their steadiness in your hardest moment is something you carry with you still. Because they carry you too. Long after you have gone home, they carry you too. So here's what I'm asking you to do today. If someone in a cardiac unit showed up for your child or your family in a way that changed things for you, share their story, not their name, if you want to protect their privacy, but their story, what they did, what it meant, how it felt to have someone in that room who saw your child as a person and treated them like one. Share it with us at heartbeatforward.org. Share it in a review of this episode. Share it anywhere someone might read it and feel seen. Because the people who work in pediatric cardiac units deserve to know what they do ripples outward in ways they will never fully see. That families they care for carry them forward. That their work matters beyond the walls of the unit and beyond the length of the shift and beyond anything a performance review will ever capture. And if you know someone who's worked in a cardiac unit, share this episode with them today. Let them hear their own story reflected back to them with the reverence it deserves. Visit heartbeatforward.org to learn more about our mission and how you can support the children and families at the center of this work. Thank you so much for being here for episode 6, to Rosa, and to every person who has ever stayed, who has ever chosen, shift after shift, to walk back into that room and to give everything they have to children who need it and families who are hanging on by the tiniest thread. You are the unsung heroes of this story, and today we sang. This is Small Hearts, Loud Voices. I am Adrian Adair, because every small heart deserves a loud voice.